Hello, everyone. Welcome to our webinar on health protection of youth with disabilities. We started 2 minutes late since we are still waiting a bit people to join. We already have a few participants, I see. That's good. They are getting more and more. We are here with Miroslava Ivanovic and Nora Eklov from Sweden and Mima from Montenegro. And hopefully soon will join also Stelios Kympouropoulos from Greece. I am Kamil Goungor. I'm also from Greece and I work for ENIL, the European Network on Independent Living. I am the development officer. Well, glad you are all here. Probably more people will join in a few minutes, hopefully. Let me give very quickly a few details about the webinar. Maybe let's see if I can try to share it my screen. Put a list, everything is slow. Works. Okay, anyway. So I will give the program doesn't work very well, but that's okay. The screen is not needed. We don't have really a PowerPoint presentation and you see us on, so that's okay. I just have some basic rules. I can't say anyway. So before we start, I want to tell you that everyone will be on mute, except the speakers. And if you want to ask a question, you can type it in the Q&A box at any time during the webinar, or you can raise your hand. It should be possible in the chat room section. I always confuse these two. I will check regularly to see if anyone has questions or comments. If you have any problems, send a message to me. Either in the webinar to the, I think I will be indicated as an email to the webinar organizer, or to my email, which is kamil.goungor@enil.eu. And I want to know to let you know that the webinar is recorded and we will upload it on YouTube soon. Probably not today, but tomorrow or the day after tomorrow. You go to the youth channel of the ENIL Youth Network, the YouTube channel, and also all the participants and the people that are registered will get the recording link and the presentations, which for some reason I cannot open now. I don't know why, but it's okay. And it's a very basic. So today we are having 3 speakers, hopefully. The 2 are already here. The first one is Miroslava Ivanovic from Montenegro. She is a co-vice chair of ENIL Youth Network. She's a lawyer and executive director of the Initiative of Youth with Disabilities on BOCA in Montenegro. We have also Nora Eklov. If I pronounce your name, girls, not correctly, please do it correctly when it's your time. So Nora is from Sweden. She is also board member of ENIL Youth Network and Secretary General of the Swedish Youth Federation of Mobility Impaired. And the last speaker, hopefully he will join soon, is Stelios Kympouropoulos from Greece. He is member of the European Parliament. He is psychiatrist and board member of iLiving, the independent living organization of Greece. So today we discuss about health protection of youth with disabilities. And why we discuss this? Why the Youth Network chose this topic for a webinar? Because for various reasons, such as discrimination and accessibility, any reasons you know by yourself anyway. And many persons with disabilities, especially youth, are not able to go to the doctor regularly or do not have sufficient knowledge and awareness about their rights or access to health. In many countries, maybe ask for help, health protection, but they receive very low or nothing because, yeah, all of the barriers they face. This is especially the case nowadays because of the coronavirus. We'll hear about it a bit later, which the system, doesn't function well. And yeah, this is problematic for people to access health systems. Some of the areas we will hear about today include health rights and how does CRPD guarantees these rights? How did the coronavirus pandemic impact them and the whole health access to health system? The role of support services. How is mental health affected of young people with disabilities? Is it affected? Is it not? Stuff like that. And what does the EU to support youth with disabilities to access health? This is only a few things. I am sure our speakers will, enrich the discussion and will go deeper than what I did. That's the point. I will close now my camera and we will give the floor to Nima. She can say maybe 2 words more about herself. And Nima, the floor is yours.
Thank you very much, Kamil. Thank you for all of you who dedicated your time to participate in this webinar. I'm active in disability movement in my country since 2007, and in last few years I spread my activism into international disability movement through especially ENIL Youth Network board. As a person with disability whose disability is caused by illnesses, I know how much the adequate health protection is important for even survivor of persons with disabilities, because in many countries, even in those named as modern and democratic and economically developed, we also nowadays have very strong medical approach to disability emphasized in the societies and especially in the health protection system. Usually, medical staff see persons with disabilities as hopeless cases for medicine because, as you know, impairments can't be cured, but can be kept in the stable status without progression if adequate health protection is provided. So that's the reason why the Convention on Rights of Persons with Disabilities has one article dedicated specially to health protection of persons with disabilities. And I will speak a little bit about the meanings of the provisions and guarantees provided in that article, and what the text of that norms mean in practice. What are the situations covered by that norms? And also, if you have some questions, I'm open to answering that. Article 25 guarantees the health protection of persons with disabilities more detailedly. It obligates the states parties the states which ratified or signed the convention to undertake measures to ensure that there is no disability-based discrimination in the area of health protection on their territory. And what does that mean? That means that all health services which are provided to other public, to other persons who don't have disability, have to be provided to persons with disability with all with the same level of quality. So, for example, if you have vaccination, for example, for coronavirus, when will it be provided? That means that that service has to be provided to persons with disabilities too, and that health professionals and health systems has to provide that service, that treatment for persons with disabilities under the equal conditions as to persons without disabilities. That means that vaccination has to be provided under the equal financial costs, under the equal administrative procedure, if there is concluded that they are medical preconditions are fulfilled by person with disability, and that that service has to be provided in the accessible environment, that actually person with disability can enter into institution, into health institution where that vaccination is provided, that the procedure for vaccination is the accessible medical procedure, actually that device, the medical equipment such as, for example, medical beds or some other equipment used by patients is also useful and accessible for persons with disabilities. And maybe, first of all, that persons with disabilities are informed about vaccination, the procedure, how to obtain it, what can be expected by that vaccination, what good effects, what bad effects, and when and how can it be, where, how, and when can be it can be obtained. Actually, that means that you are informed on in the format which is acceptable, so you can know that the vaccination is provided also for you. Because if you don't have information in the accessible format, for example, sign language or text format or learning easy to understand format or audio format for persons with visual impairment, that's not health protection which is provided without discrimination based on disability. So I mentioned a few things which are covered by Article 25 that are actually equal range, quality, standard of health protection for persons with disability, that is free and informed consent. What does it mean? That when you have information, you're not obliged to go to the treatment, but to decide whether you want to receive that treatment. So if we receive the information about COVID-19 vaccination, then we are free to decide whether we will go to that treatment and receive that treatment, but not other, which are mainly medical experts, who will say, oh, your group in risk, you have to be vaccinated, you have to receive that treatment because we have that obligation, and so on. So that's the right which is very, very often violated in practice, because medical staff is not trained how to communicate with persons with disability in inaccessible format and in understandable way. Usually they use very complicated medical phrases, and that is not, in most cases, understandable for persons with disabilities. So, in such a situation, when you don't know what is going on, you actually can't offer free and informed consent, even when you provide your consent. It's usually not free and informed. The other question is about about decision making related to health protection issues. When it comes to persons who are denied the legal capacity. In many countries, that is the case with persons with intellectual, mental, and psychosocial disability. They unfortunately don't receive any information about their health protection. The other very important issue when providing and receiving health services by persons with disabilities and to persons with disabilities is where that services are provided. In almost cases, many health institutions are not physically accessible or do not provide service language interpreters or easy to read formats or other types of support needed for persons with disabilities to fully enjoy the right on self-protection. So in many health systems, there are some health institutions which are physically accessible and which provide other accessible and support services for persons with disabilities. But the Article 25 of the Convention on the Right of Persons with Disabilities prescribes the obligation of state parties to ensure the health protection as close as possible to the homes of persons with disabilities. It means that you have to provide, you have to receive the health services in your home time and also in rural areas if you live there. What is very important is that the UN Convention does not prescribe the obligation of state parties to provide the equal range, quality, and standards of health protection to persons with disabilities as that provided to persons without disabilities, but also it obliges state parties to develop and provide specific health protection services to persons with disabilities which are needed because of their impairments. What does that mean? That means that many of us who, due to specific type of our impairment and cause of that impairment, whatever is it caused by illness or some injury or some or it happened before person was born. We need some specific health protection services. For example, some specific kind of health rehabilitation or some specific therapy for our health problem, or something which is specifically dedicated to our situation. So, in that sense, states must provide also that specific health services dedicated to persons with specific types of impairments. This is very important when it comes to right on early identification and intervention. What does it mean? It means that the UN Convention on the Rights of Persons with Disabilities prescribes as human rights of persons with disability early identification and intervention. Actually, that our human right is to have our diagnosis early in that decade, so that we don't spend years in trying to find what is actually our diagnosis and what is actually our health problem, but that the state is obliged to ensure that we will be diagnosed in some reasonable time. Also, the other part of this specific right related to health protection is early intervention. What does it mean? That in many cases, persons with disability have to be followed by multidisciplinary teams of medical professionals from different medical areas have to follow a person with disability because some injury or illness or some other health problem can cause many other side effects related to early intervention, that early identification, and when we identify some health issue, we have early intervention. We have some medical treatment or health rehabilitation treatment, or some additional treatment within the health system, in very fast period, and we don't have to wait for years to get to them. Unfortunately, in many countries, they are not provided specific health services dedicated specifically to persons with disabilities, and many persons with disabilities have problems with early identification, early diagnostification, let's say, and with early intervention. The violation of that, of these rights causes the violation of other right, which is also recognized by Article 25 of the UN Convention, which is minimization or prevention of progression of disability. I would rather say impairment. When you have early identification and early intervention, especially when medical experts from different medical areas are engaged, you can prevent progression of your health problem. And then your impairment would be lower. That would cause that you would need less level of health protection, and besides you would have better health status. The health system would not have too much obligations to provide you many kinds and many range of health services, because the progression of your impairment would be provided. This is very important issue, because we every day face with the situation that neither we can enjoy the health services which are provided to persons without disability, nor we can enjoy these specific health services which are needed to treat and to minimize our health problems and also impairment. One very interesting right, which is guaranteed in this article, is the prohibition of disability-based discrimination in using health and life insurances. I don't know what is the situation in your country, but in Montenegro, I don't know whether there is some private health and life insurance which provides the same conditions for persons with disabilities and for persons without disabilities. By this article, that situation is prohibited, but we have also, state parties have also the possibility to influence this area, but in reasonable scope, and that means that we have to respect the principle of reasonable accommodation, that the needs of every person with disability in case have to be discussed and analyzed very carefully. But in this area of health and life insurance, many insurance companies prescribe many discriminatory conditions for persons with disabilities, and persons with disabilities very often do not have equal access to health and life insurance as persons without disability. What is very important is to know that if your country ratified the UN Convention on the Rights of Persons with Disabilities, then the convention has to be implemented directly in on your case. What does it mean? Even if you have some discriminative health health laws or other legal documents in your country, the convention has to be implemented without implementing that laws. For example, in Montenegro, we have Montenegro has ratified the UN Convention on the Rights of Persons with Disabilities, and the convention has to be implemented directly to everyday life of persons with disabilities. Unfortunately, that's not the case. But what is good is that you can proceed institutionally the violation of rights which are prescribed by the convention. So, if some of the mentioned rights within the health protection of persons with disabilities under the Article 25 of the Convention on the Rights of Persons with Disabilities address the relevant institutions, the competent institutions, and say that that right under Article 25 of the convention is violated, and that you ask for legal protection of that right. The situation is different if your country didn't ratify, but it signed the convention. When the convention is signed by the state party, then the convention is not implemented directly into everyday life cases, but you also have the possibility to use it in arguing the violation of your rights recognized by the domestic law, because you have one argument plus, because not only the rights on health protection guaranteed by domestic law are violated, but also the international legal documents which guarantee the rights of persons with disabilities and state parties' duty to fulfill them. And on the end, but it's not the less important issue, the least important issue, maybe it's the most. The health protection is one of the economic, social, and cultural human rights. Economic, social, and cultural rights are the type of human rights, because human rights are divided in nowadays in 4 groups. So health protection, right on health protection, the right from human rights group of economic, social, and cultural rights. Why that is important? Because those rights under the international law are not obligatory to state parties to be immediately implemented. So, if your country ratified a convention 5 years ago, in the same moment, in that same year, provide all these rights within health protection of persons with disabilities, because those group of human rights have to be implemented progressively. So it's a little bit disappointing, but our states which ratified the convention do not have the duty to provide us with all these rights in all their scope immediately, but they have the obligation to, through the time, make a progress in this area, and they are prohibited to make steps back in the guaranteeing and providing adequate health protection to persons with disabilities. So our state parties are not obliged to do everything now, but they are obliged to do something good in long term, and also they are prohibited to do something bad since they ratified the convention. Also, what I want to emphasize that these all issues, all rights mentioned cover the sexual and reproductive health too, and that the gender based sensitivity must be taken into account when designing and providing health services to persons with disabilities. I tried to describe what Article 25 covers related to health protection of persons with disabilities, but there are also very specific issues when it comes to health protection of youth with disabilities, because due to our specific age, state parties have to take into account also specific health problems and specific health needs of youth with disabilities, and to work on creation and implementation of measures which will address them. So it's for now. I think I hope I was not so boring. And if you have questions, please answer.
Thank you a lot, Mima. Yeah, you spoke a bit more than the time I had in mind, but it was like really interesting and something we don't hear every time. The angle you approached the issue, and under the convention and everything. So I think it was super interesting, and people probably learned a lot new information. Personally, I learned things I didn't know. Without further ado, I will give the floor to Nora. But before that, I want to welcome Stelios. Kympouropoulos, he joined us, our member of the parliament, and other things I mentioned earlier, and we'll mention it later. Just to tell you, while Nora is speaking, you can already, if you have any questions, you can, while Nora is speaking, if you have any questions for Mima, you can do it. And also, Stelios asked to, instead of just speaking himself for a long time, to interact with people. So he will say a few words, but he would like you to ask questions. So if you have questions for a member of the European Parliament, or a psychiatrist, which is also a Stelios, one of Stelios' identities, feel free to already post some questions which he can answer later. And of course, the same applies to Mima and to Nora. Now I give the floor to Nora. She will take us to a bit more specific example from her country, and Nora, what else? The floor is yours.
Yeah, thank you. Yes, as Kamil said, my name is Nora and I am 24 years old, and I have been active in the disability movement in Sweden since 2015. I have been asked to talk about the Swedish corona situation because I know that many have questions about how Sweden deals with the virus. But I also want to talk about how the lack of support services like personal assistance affects young persons with disabilities during this time of crisis. I want to begin with paying attention to that many disabled persons don't have the access to support services. They are normally spending the most time of their lives in a quarantine-like house arrest with no or less opportunity for independent living and seeking healthcare. So this situation isn't anything new for many of us. Isolation is already a part of our everyday life. The difference is that it's normally not a virus that prevents us from living our lives, but rather an authority or a municipality that removes our opportunities for empowerment and participation in society. I hope that the current situation can inspire all of us to take actions in the interest of a future society where everyone's rights to liberty and empowerment is fulfilled. To talk about how Sweden deals with COVID-19, I want to begin with explaining that the bureaucracy in Sweden is something that is very complex and strictly followed. We have laws, actually one of our constitutional law, that doesn't support a lockdown or a mass quarantine, and that protect the freedom of liberty of people. That's why our government haven't made any decisions about a lockdown. I think that that's why the situation and the way Sweden deals with COVID-19 seems to be so controversial. Because instead of implementing bans and rules, you let the people themselves take responsibility for spread of the infection. That can also be one reason for that Sweden seems to be so unprepared for this kind of crisis. Well, there are rules and restrictions during COVID-19, but people don't care so much about them, and there is no penalty for breaking these restrictions. The government claims that it doesn't strive for herd immunity, but that may be the result of this tactic. It may also result in sacrificing many lives of elderly and disabled people for the sake of immunity. The Sweden approach doesn't affect everyone equally. Those of us in risk groups are forced to live in isolation in an attempt to shield ourselves, while the rest of the society continues almost like normal. One thing to remember is that the reported number of deaths from COVID-19 is affected by the testing strategy and many other things that differ between countries. In Sweden, the statistics shows the numbers of people with confirmed COVID-19 who have died regardless of the cause of the death. Additionally, they are reported based on clinical diagnosis, that is, their symptoms match with COVID-19, but they have not yet been tested. This means that Sweden reports debts more generously than other countries with more restrictive approach to counting the number of deaths for COVID-19. Sweden, as well as some other countries, has failed to protect the elderly and people who live in care homes because infection has entered the homes. That's also one reason that Sweden has so many deaths reported. But during COVID-19, young people with disabilities who live with their parents and personal assistants or home care services have less opportunities to protect themselves from getting the virus. This is because the parents may go to work or the assistants have other jobs or activities in their spare time, which may lead to spreading the virus to young persons in risk groups. But to remember is that the need of support services doesn't decrease just because of quarantine or COVID-19. Yes, that's all for now. Thank you.
Thanks a lot, Nora. It was very interesting to hear about Sweden and how they approach the situation. I think all of us hear a lot of myths and a lot of stuff about Sweden, and everyone is wondering how it works. So you gave a good insight on that. And yeah, you also highlighted that not everyone is affected equally, and this is something we need to consider and to think deeper, even in Sweden, which is like a country really developed and a role model for other countries. So yeah, but yeah, coronavirus doesn't look on how rich your country is or not, or how developed it is. Yeah, it doesn't work that way. So now we go to Stelios Kympouropoulos, from Greece, as I said before, member of the Parliament, of the European Parliament, and psychiatrist. May hopefully, Stelios, can you hear me?
Yes, hello, Kamil.
I don't see you.
Yes, I know that I'm not. I can only speak not to sing because I cannot open my web camera at the moment. So you can, our participants, they will just hear me. Sorry for that.
No, I mean, it's understandable sometimes. Technical issues happen.
Exactly, technical issues and the full program is sometimes difficult for us to be the right moment, the right moment at the right place. So thank you very much, Kamil, that you invited me to be here with with everyone that who participates. My name is, as Kamil said, my name is Stelios Kympouropoulos. I'm 35 years old, and I'm also a disabled person living in Greece. And by professional, I'm a psychiatrist, and also I am a sexologist. So I have a very great interest in the issue of human body, and your topic is very great because I think that first of all we need to care to love, let's say, to love our body and to have a self-determination for our body. What I mean is that our first our first step is to love who we are, without the feeling of our impairment. without either we are disabled or non-disabled person, we need to love who we are. So if we accept our body, after that we can take care of it. We can go to the doctors. We can go to 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 psychiatrist, to mental health if there is a mental health issue, and we can share with our problems with the person that we trust. Uh, what is the problem is when we live, from my point of view, when we live in a institution. As we saw during the coronavirus crisis, we saw that many disabled people and or elderly people who live in institution, they left alone, and they faced many cases of coronavirus. So I think that the problem is that we need to create in every member states to create the system of personal assistance in order to have the opportunity to decide whenever and where to go to get the appropriate health care. From a parliament point of view, I am a member of the disability intergroup, and during my mandate, I try to pass legislation and laws who support the person with disabilities to live with all ways and support the idea of UNCIPD. I think that it's a non-bilateral issue between disabled person and non-disabled person. If we have access to education, if we have access to hospital, if we have access to the family, and to our way, we can have also access to health care system. I think it's a difference between among member states, but the most important issue is to raise awareness and not be fear of our impairment or our handicap. We need to accept ourselves as it is, as we are, and we need to act in a way that we are not feel the exclusion that the society forces us to the borders. So I think that it's a good time to have meetings like this, and to raise our voices in a way that we feel okay, we feel fine to be as we are. Kamil, thank you very much for inviting me to be here with you. And if there is any question, please let me know.
Thank you, Stelios. I don't see yet any questions either in the Q&A box or in the chat. Feel free, guys, to ask questions.
And
Maybe I can ask one to Stelios.
One more question. I want to state, if someone from our participants wants to say ideas or whatever he wants, he or she can share ideas, sending me an email through the parliamentary email.
Okay, thank you very much. That's very kind of you. I see a raised hand from Rados. So I don't use the I don't manage Zoom very often, so I still looking how to operate it. But I will try to give you Rados the permission to talk. Let's see if it works.
All right,
okay.
I think it's fine, right?
Yes.
Hi, everyone. Thank you for lovely presentations and for your initiative to hold a webinar on such an important topic. It was certainly fascinating for me to hear all your inputs. I was wondering if you have any thoughts about some things that Mima mentioned in her presentation about the early interventions and the early diagnosis of the impairments in terms of how do we distinguish between the situations when some medical interventions are truly warranted and contribute to person's well-being, and some medical intervention may only seek to normalize the body and thus imposing unnecessary pain, some suffering, surgeries, and the related recovery. For example, I went through a number of surgical treatments, orthopedic surgical treatments in my childhood, and some of them even contributed to worsening of my impairment rather than improvements. So how can we actually ensure that we advocate for disability-specific treatments, as Mima said, but on the other hand, we struggle against normalization treatments? Do you have any thoughts on this, because I'm currently doing my PhD research on disabled children's participation in healthcare decision-making, studying in particular the surgical orthopedic treatments on disabled children, impairment-related ones. And if you're interested, I would very much like to engage with the ENIL Youth Network in this research, but we can chat more about that after. So if you have any thoughts about this question, I don't know if you heard me well. Yeah, I would love to discuss.
Thank you, Rados. Let's see if Mima, since
yes,
I think it's addressed to you. Do you want to answer?
Yes, sure. It's a very important and great question, and the topic you're addressing in your PhD thesis is very good. Maybe I forgot it to say that all these specific rights within health protection of persons with disabilities, we have to see them and understand them connected to each other, because one specific right without the other is nothing. It also is about the right on early intervention and this treatment you are talking about, because a medical expert do not have to decide but the person with disability in case has to decide. So the task of the medical expert is to well identify the health problem and to well present the health problem and possible medical treatment with all their good and bad effects which can they cause. So on the person with disability is whether he or she will accept that medical treatment, and that is the reason why I said that this right is almost violated. And when it comes to children and youth with disability, their decision making and their free and informed consent to health treatment, it's very critical issue, very taboo, let's say, issue, because you know, many youth are many youth until 18 or in some countries 21 year don't have full legal capacity, and the decision making about health protection is decided by their parents or other persons. So that's the question on your answer. If you say, okay, I know what to expect, I am okay with that risk. I will do it. For me, it's better to have a very big pain and so on, but I want to walk or do whatever. Then that's your right to decide whatever you want with your body.
Thank you. Thank you so much for your answer. I think that that's really important point. The decision should sit with the person, but yeah, in the case of children, it's quite complicated. I agree, and maybe I could send you. I intended to contact the ENIL Youth Board, and to send a little bit more information about my research and how you can get engaged with it. And I think there are quite some issues around overriding children's consent or children's wishes by parents and the legal capacity of children, as Mima mentioned. So I'm glad you started this topic and you covered it well in this webinar. Thanks.
Yes, others please do. I mean, in collaboration with this network, I think it's good, and any ideas are welcome from the board, I think. And I mean, the board also has, as you can see in these webinars, a lot to contribute to some cases. So yeah, I'm sure that it can be beneficial mutually to both of the sides. Let's see if there is any other question. If anyone wants to ask something, feel free to raise your hand or to type the question. I am checking everything. Meanwhile, until someone, because I don't see any question, I will ask one. I have one for Stelios and for Nora to keep the ball rolling. Let's start with Stelios. Stelios, would you like maybe tell us a little bit about mental health and the issues maybe from your perspective as a psychiatrist, the mental health issues in this period, especially of coronavirus? What did you notice? We know that you offered your services for free as a psychiatrist to speak with people online and to have, how you say it in English, calls with people and to sessions discuss. What is your outcome from that?
Yes, thank you, Kamil. Before answering your question, I would like to give my point of view to Rados about the last question. I think that because a very serious issue, how to protect child, disabled child from creating more problems than making better. I think that our most important weapon is the information, is to share the information as much as we can in society, telling that don't be feared of disability, and that the disability it's not the problem. Disability is the social construction of the obstacles of the inaccessibility, and I think that wherever we go, we can share the information of social construction of disability. And after that, I think that we can make some steps toward the acceptance. According to your question, Kamil, yes, during the Greek lockdown for COVID-19, I gave my support to the people who are in need in mental issues problems. It was a very difficult period for many people with or for non-disabled people and also for disabled people to remain locked in their homes, and this perspective raised the anxiety, raised the depression, raised the fear of the future, the unknown, the fear of the unknown of the future. So I think that it's not a competitiveness between disabled people and non-disabled people. It's how you face your reality. And the reality is that anyone, people with or people without disability, can face a mental health issue. And according to the Greek reality, and I think the same is in many European countries, especially for psychiatrists and specialists on mental health issue. They can treat anyone who faces a mental health problem. So whoever feels that he or she is depressed, he feels anxiety, he feels that the life has any happy, any good reason to live, she or he should visit a mental health specialist in order to support to support his or her life, because the life is good, and the life we can make it better with the support of a specialist, especially for mental health.
Thanks a lot, Stelios. I think it's very clear, the message. And it's very interesting also. It's an issue which, from my perspective, I see that a lot of people didn't think about it ever. But now with the corona times, a lot of people realize that mental health issues is a real thing, and it can affect everyone. So it was there, it was submerged or something, and now the coronavirus took it to the app, and people realize that it's happening. So yeah, it's good that there's also this perspective. I see a comment by Maud, sorry if I don't pronounce it well. It says, in the case of children in alternative care, there are legal questions which differ from country to country. Thanks so much for raising the topic, Miroslava. I don't know if you want to add something for that, Mima, about children in alternative care and the legal.
Yes, to agree, actually, there is nothing to add. There are many problems depending on the legal the country.
Okay, thanks. I see the hand raised by others. I think it's from the previous time, unless you still raised it, just to be sure.
No, it's again. So I hope I'm not taking away the opportunity from others to ask. So, but if there are no other questions, I was inspired by one of the things that Stelios mentioned in the beginning of his presentation, and that's that young people should learn how to love their bodies. And maybe the question to all, what do you think? What are the strategies that the person can use to create positive identity related to impairment and disability, rather than seeking or trying to for the body to be fixed or cured by the medical interventions? So what do you see as possibilities to develop the positive identity related to impairment and disability in adolescence and young age?
Who wants to go first, since that was asked everyone?
Okay,
Stelios?
yes, can I can answer this question? Those, it's I think that everything starts from the first years of the newborn, baby, newborn, the child, and around the age of 12, I think. It's the milestone that if you have get enough love for your body from your parents or whoever take care of you, I think that is it's the most important path to respect your body as it is. So therefore, I suggest and I support the idea of information to everyone, because many people, many child and many newborns are born with an impairment, and which in the future will become a disability because of the obstacles of the society. So if we have a general information towards the society that respect your baby as it is, I think we create a new perspective of thought for disability, what the meaning of disability in society. So I insist that our weapon, our way of changing, is information, and to be proud that we are that we have our impairment and we live in the way that we live.
Thanks, Stelios. Any additional comment on the question from Mima or Nora?
Yeah. I can.
I see both of you want to say something, so.
Yeah, me.
Oh, Mima, and then we'll go to Nora.
Well, I would just add something as a legal, maybe, or administrative part of the answer. Here is very important the cooperation between health and social welfare systems, because these systems should to have very close cooperation. So if somebody is identified by some impairment, long-term impairment, which causes disability, by the health system, it can be, it should be, let's say, forwarded, or some other word to choose, forwarded to health system psychological support, or sometimes maybe psychiatrist support, or to psychological support, which is provided by maybe social welfare system. Because I think that to accept disability as the part of your identity is not only the responsibility of yourself and your family. Your family has to be supported by the system, that the disability is not tragedy, as well as you as a person with disability, especially when you are youth person with disability in such difficult times when you have problems with all your spirit and body. So the system is there to help you, to provide you with the support, and on you is whether you will accept it or not.
Thanks a lot, Nima. That's a different approach from the legal perspective. Was interesting. And now we'll give the floor to Nora. If it's like adding something for that, or anything else.
Yes, I just want to add that I think it's important to see from the beginning that in all the levels in society that everyone has the right to live equally. You have the right to not be an experimental subject. It's important then that the authorities and governments accept and respect their obligation to guarantee our rights according to the Convention on the Rights of Persons with Disabilities. And we have the right to empowerment and autonomy, and we have the right to liberty and to decide how to live our lives. Yes.
Thanks, Nora. Rados, was this covered your question? Do you want to follow up or something? Or okay, Rados text that thanks everyone for your answers and reflections. So that is fine with the answers. We still have a few minutes, guys, if you feel like asking question either by in written form or or to speak. You can just raise your hand and I will give you the permission to do that. Yes,
Kamil, sorry, I have to go. I need to go because I have another obligation at this moment. Thank you very much for your for the organizing of this webinar, and I hope to see you soon in a future topic and a future webinar.
Thank you a lot. Thanks a lot, Stelios. Well, I mean, politicians are busy, we understand it. And I will say again what you said before, that your email and your office is open for people to reach in the future. Even if they need anything from a member of the parliament, they can always contact you. And yeah, that's important too, from your perspective. Thank you a lot for joining today. So yeah, let's see if there's any other questions. If it's for Stelios, then I will transfer it later on. I have one for Nora meanwhile, until maybe anyone wants to ask something. I would like to ask to Nora, since we are from ENIL, the European Network for Independent Living, independent living and personal assistance, and this stuff is our stuff. This is our, let's say, main work. I am very curious to see how it was during the coronavirus pandemic in Sweden. How much do you think it was affected in real life? What were people, I mean, you mentioned a few things, of course, but maybe, I don't know, you have any like personal story of something for people like being without assistance or something, like we here in other countries, how it was? How much was independent living affected from the pandemic? From your experience of your colleagues and everything.
Yeah, as I said, it's maybe hard to protect the health and I mean our health that doesn't have the right to personal assistance or lack of the right to personal assistance, because we often live home with our parents, and they need to work, and maybe we have the lack of assistance, but we have some some help, and we need to go in quarantine to protect ourselves, and you got less help. So it's hard to live independently right now and to protect ourselves. Yeah.
Thanks a lot. I see. Yeah, we had a lot of stories from various countries, or like, I don't know, assistant gets sick and leaving the person without anyone, or assistants refusing to come to a home because they are themselves afraid or whatever. So yeah, it's difficult times and difficult for everyone, I guess, and especially if you need support for many hours and you are relying on that. Hopefully it will soon end and everyone will come back to normal and will without any further complications. Is there any other question or comment from anyone? Either the participants, I mean the attendees, or the speakers, or should we say, should we close it? I will give a few seconds in case someone wants to type something, or if someone wants to raise his or her hand to speak. And of course, if one of the speakers wants to speak, feel free to do it. If not, we'll say goodbye, and I will. Anyway, we have like 6 minutes left, so it's almost our time. Let's see. I don't see any activities so far. So I will slowly thank you all for joining. The webinar is recorded and it will be uploaded to the Youth Network YouTube channel this week, one of these days, maybe tomorrow or the day after tomorrow. And to all the participants will receive the recording by email as well. What else to get? I want to thank all the speakers, Miroslava, Nora, Stelios who is not here, and all of you who joined it and asked questions or just listened to this very interesting, in my opinion, webinar. With Youth Network, we don't stop here. I am sure that during the future months, there will be another interesting webinar on other topics that are interesting for people. This is already the second webinar. The first one was on peer support. If you have any topics you would like to hear in a webinar, feel free to text us, to email us. Let me try to share the screen so you can also see the email. Sorry also for the technical issues today. Yeah, we're still learning how it works, but it's better. So in any case, this is the email of ENIL Youth Network board. And you will also receive my email, so you will have it my email when I send the material later this week to everyone. So I will stop sharing my screen now. Thank you all again. And yeah, we stay tuned for the future activities we'll do. Thanks to all speakers, attendees. Have a good rest of the day. And yeah, stay healthy. Bye.
Bye. Thank you.
Bye.
Bye.